Let's talk about stem cell injections in Dallas. And as I said, we have started our Dallas office, and we're providing stem cell injections. These are also known as regenerative injections. We have, when you hear about plasma platelets, PRP injections, stem cell injections, cellular injections in Dallas, that's basically what we're talking about. So we are providing RegenX stem cell injections in Dallas. RegenX basically is our brand name, where we have a proprietary method of processing stem cells and injecting them. So this is basically involved in tremendous amount of research. RegenX has research and data-driven practice models which we apply. So we're like 26 people, I guess, throughout the country providing RegenX procedures, and I'm providing in Dallas, Texas, Houston area, as well as in Oklahoma. Wherever you see a RegenX brand, typically we're all doing the same thing, because in the world of stem cells and the regenerative medicine, interventional orthopedics, regenerative orthopedics, you have to have some kind of unity, in the sense like a power in doing research, because these are relatively new fields and tremendous potential, and the popularity is growing, and we need to have quality maintenance throughout the board. So that's why we have teamed up together and believe in our research product, and as well as clinical outcomes that we've been getting and the patient's feedbacks. And this is an absolutely a safe procedure, so there is no issues with the safety. So that helps us provide these procedures. That's why we're doing it in Dallas, DFW area, Fort Worth, as well as Texas and Houston areas, providing these procedures to most of the patients that are good candidates. So a lot of patients in the Dallas area, they're looking for alternatives. They're looking for surgical alternatives. Hey, I have a problem with my ankle, my hip, or knee, or shoulder, neck, whatever, but I'm too young, or I really don't need surgery. So what else can be done? Yeah, I have a torn meniscus, or I have a minor tear. Do I really need a major surgery for that one? Or are there any surgical alternatives? So that's the kind of patients we get a lot of inquiries. As in RegenX, we do get a lot of inquiries. Hey, am I a candidate for stem cell procedures, stem cell injections? They can be called as multiple names, but the cellular therapy or plasma-rich platelet injections. So we evaluate those patients. We look into their MRIs. We examine the patients, and sometimes we talk to them over the phone if they're in a remote location. And we decide if these are the right kind of patients, and these stem cell treatments are the right fit for these patients, basically. So all these factors decide who becomes a good candidate, and then what they can expect out of those procedures, results-wise. And what we are seeing clinically these days is significant amount. We're talking about like a high amount of patients are successfully avoiding any kind of a surgical treatment at a later point. So we're able to catch it early, heal it, and reverse it, rather than let it degenerate and go to the next stage. So that's where a lot of people are searching for these kind of stem cell therapy, stem cell injections. And we do, as I said, like even in the office in Dallas, we get a significant amount of inquiries in that regard. So surgical alternatives is one other way of people looking for it. So not necessarily all degenerative conditions, or even an acute injury, for example. Hey, you need surgery. Oh, you got a meniscus tear, you need surgery. But now, people are pausing it, looking at, oh, okay, why do I need surgery? Can I get without surgery? Because as we know, surgery has multiple complications. There is a success rate in surgery as well, but not everybody is a candidate for surgery. And these treatments were not available. The stem cell treatments, the plasma-rich platelet treatments were not available to mainstream public a few years ago, but now they are. So this gives a very, very viable alternative for these kind of patients.